Welcome to Breakfast at Cheng's in Saratoga, California. I'm here with our Patient Care Coordinator Edina, and today we're going to be talking about long-term care and how to maintain your surgical results. Are you ready?
I'm ready.
Ooh! So first question, you are at our office in charge of helping patients get ready before surgery as well as helping them after surgery with anything that they need. So what do you think are things that patients can do to be prepared for their surgeries?
Yes, so I think an important thing that we do here at the office is that you do have me to use as a resource for whatever questions you have. Obviously, you're going to meet me during the actual process. Either beforehand, we'll have a conversation, or of course, after you've consulted with the doctors, and explain the process, how it all works, what you need to do to prepare, before, after, because I think the recovery part of the surgery is really important, and making sure that you have even just support at home, even if it's a friend, if it's just someone that you can call, because surgery is a very emotional thing. And so to actually decide to do it takes a lot. And for us, it's the face. And so it's not something that you can necessarily hide if you're, So I think a lot of that is just knowing that you have support. And I think that we do a really good job here in the office to help patients with that.
I think you specifically do a very good job of helping patients with that. You're incredible.
Thank you. Well, I love what I do. So it makes it a lot easier when you just know that you're helping patients in the process of what they're going through, because again, it's very emotional why people are doing this, and when you can be a part of that, it's pretty cool. Well, all right, so French toast today too. First time honestly making French toast. Well, not first time, but usually I'm a waffle girl just because there's not much like you need to do, and I feel like this is so let's see how this turns out.
The good news is it's an easy one because you can kind of eyeball whatever you need to. So
love that.
Yeah. Obviously, aftercare is super important in healing from surgery. How important would you say that first week in particular is?
Super important, right? So you want to make sure, again, when you're coming, that you're avoiding the things that we've asked you to avoid. You've set everything up at home so that things are easier for you, just reading everything through. And then that way, when we're explaining what you need to do, it makes a lot more sense and you're not overwhelmed. Simplifying it, even putting instructions on your mirror, something like that, to just have a resource or a quick little, hey, that's what I need to be doing, and simplifying things that way, because literally that is your job for the next week. And taking it serious and putting in that extra effort is really going to be helpful in that recovery process. I mean, there's definitely things that you can do outside of the office to help that. And I think a lot of that, hyperbaric chambers help. We do red light in the office as well as O2, because all those little things, I think just mindset helps. And then just to be in a good place. Because again, with surgery, you're not laid up. So we want you moving. We want you doing things, even if it's taking a walk, just nothing strenuous. We want to make sure that you're not laid up in bed. And we know, when you're not feeling great and you're in bed and you kind of start getting that little depressed feeling, you want to do things that make you feel better. So, it's a good time to listen to audiobooks or catch up on just, podcasts and things like that maybe you don't get to spend a whole lot of time doing, but that just kind of clear your head and just make you feel better.
Oh, yeah, I love that. Mm-hmm. And then long term, what are things that patients can be doing long term to really help maintain their surgical results?
Well, I mean, definitely the part of surgery I think that a lot of patients are trying to figure out or trying to get through is oftentimes, even though they feel normal or they start feeling normal, they think that their final result is early on in the process. Even, at 1 month, I'll have patients say, oh, okay, this is it. And it's like, no, actually, it's not. Your recovery honestly takes well into a year, even sometimes beyond that. There's swelling, there's scars, there's all of those factors that oftentimes we don't think about. And we just think, well, yeah, I feel fine. Everything looks fine, but it's still a process. So if you look at our before and afters and you can see from 1 month to 3 months to 6 months, there are dramatic changes that happen. Yes, maybe not so much that you're noticing it daily because you're seeing yourself every day and you're hyper focused on certain areas. So I think oftentimes kind of just relax in the process and just know that everything will work itself out. And I know that's sometimes hard to say when you're the one that's like looking at yourself every day in the mirror. And yeah, I think just being patient with that and knowing that, just take good care of yourself. Have an exercise program, start eating better, just different things that'll just put you in a better mindset. I think mind has so much to do with how you recover. And yeah, I think it's just helpful and it's good. Yeah, so continue like good mental health, I think is super important.
I think too, you have the very unique experience. Not only have you been doing this for almost 16 years, you've also had surgery with us. So you know it from both ends. You know from all ends, truly.
I do, yes. Dr. Jackman did my nose. It's probably been about 10 years. And so it's definitely one thing to experience it from obviously patient's perspective, but having experienced it myself, I think also gave me a lot of insight too, because I knew what to expect, right? And so it's a lot easier to explain how things work when you've actually been through it, right? And so then again, not to like play it down, but there's parts of it that you're like, okay, yeah, that makes sense. Or you see it in yourself as far as that recovery goes. The nose is changing, the scar is gone. So yeah, it's great when you can do something and honestly feel better. And I think with the nose especially, it's such a personal thing, much different than a lot of the other things that we do in the office. Those are more aging related, whereas noses, we're born with them. And so, for a lot of patients, it's just something that they've had to deal with their whole lives. And so when you see that change in someone after they've actually, done it, and you just see the confidence that it's given them and just making them feel better, it's so, I love it. It's my favorite thing to see.
And this is why Adena's the best. Teresa, when she found out we were making French toast, was like, I'm not going to eat breakfast. I'm so excited.
And I think with French toast, we want it like a little soggy, right?
Yeah.
You don't want it to.
Then it gets custardy inside. Yeah. It's super yummy.
And we know with little strips, when the staff comes in, they're going to really appreciate this because we are definitely an office that loves to eat. We love to cook. We love to eat. We love to drink. I think probably more than we like to eat, but
we love somebody's blueberry lemon cake that she makes.
Oh, I do love baking. I think that baking, cooking in general too, it's nice. And at the end of the day, sometimes, there's stressful days in our lives. And I think that baking for me just kind of helps me take my mind off of whatever it is that's happening. And I can just kind of focus on what I'm doing at that time and kind of just escape for 30 minutes or 60, however long.
Mm-hmm. And we all appreciate it every time.
Yeah, feeding people is good. I think that's just something I grew up with too. Like, it just makes you feel better, and it always made us feel better. So now if I can give that back a little bit, I don't mind.
And this is why Adena is the heart of our office. Mm-hmm. So with maintaining results, right, it's oftentimes too other procedures, right? It's like a lot of times people think like, oh, well, I had surgery, so I'm done. I don't need to do anything else. But, there's always things like skincare and Botox to maintain those results in that way. Is that something that you can talk about just a little more today?
Absolutely. I think that the most underrated, overlooked thing that people do, honestly, is skincare. I think that the healthier your skin is before surgery, and then of course, after, is super important to maintain those results. I think we sometimes see certain things that, bother us, and we think that, okay, well, there's a laser, there's a surgery. This one thing has got to just like fix it. Well, think about like how many years did it take to get to that point, right? Like, I mean, I think about my early days of sun damage, you know, and I think, gosh, I love the sun, not only the sun, but like tanning salons. And it was like, it makes you feel good. But now we're starting to see all of that damage. And so there's not just one thing that can erase that. So just maintaining those results before, I think, are super important. And it's not, again, that we want to throw like a bunch of skincare your way and not have you use it. It's like, let's address the actual issues and make sure that you're cleaning your face properly. And sunscreen, right? Like, we literally, I cannot tell you how many people come in the door and they want this spot gone or that spot gone. And then we ask, hey, well, what sunscreen are you using? And they're like, well, I don't. Well, I'm in the car, I'm inside. It does not matter. That is like the one thing that you can do. And it's start early. Please start early. I tell my daughter all the time, she's 21, but I mean, she's really good about skincare, so she knows. But that's the one thing that you can do that people overlook. So skincare for sure. Facials, anything that's going to clean those pores out, because again, you want to make sure that you're just sloughing off that dry skin. You want to just have really healthy skin, and that's a good thing to do. Botox, right? Fine lines and wrinkles. I think oftentimes people will do surgery and think, okay, well, now I don't need Botox anymore. It's different, and it depends on honestly what your concerns are. So it's not necessarily that you have to, it just depends on what is it that bothers you and then what can help. And then of course with fillers, that's volume. So even when we do a facelift or a neck lift, that's not replacing volume unless you're actually adding fat transfer. You need something to actually give you that deficiency that you've lost. And that's really common, is as we're starting to age, your notice, that sagging skin is often because we're losing that support system where there is no volume. And so, yeah, if we can kind of put it in strategic places, it's not that we're trying to over plump you, but it definitely needs something to help. Lasers, of course, like we mentioned, sun damage a little bit too. That really will help with improving on your brown spots and again, fine lines and wrinkles, things like that. But yeah, those are definitely little things that you may not realize that you may still need to do to maintain that. But ultimately, I guess at the end of the day, if it doesn't bother you, there's nothing to do, right? So I think most importantly, I tell patients, start with what bothers you the most. We're going to do a full assessment and we're going to look at everything, but don't be overwhelmed by the plan. Don't focus on what brought you in, and let's start with there. And then as we continue to know you, we're building a relationship. It's much like dating, right? It's like, we're not going to do everything right from the start, hopefully. we'll stage that out a little bit. But yeah, it's like we're all getting to know each other. And so as we build that trust and that just trust, it really is trust.
So my question for you, as you were talking, was do you find that people who maybe they've been on a good skincare routine for a while and then do surgery, do they heal faster?
Yes, I do think so. I feel, again, the healthier your skin is, the healthier you are in even diet and exercise makes all the difference in the world, because you're going to maintain those results much easier with anything, right? Even when we start like diet, we're trying to diet. And if we're not used to maintaining that, we often fall back right into our same routine, right? And so it's hard to kind of maintain that. So I think when you can establish just healthy skincare beforehand, it's going to be easy for you because you're doing it. And also too, giving yourself, you're going to receive natural results. And so oftentimes when people see you, they're not going to know exactly what you did, because your skin's always looked good. And so it's more like, oh, maybe did you lose a little bit of weight? Did you, that vacation you took served you well? And so, yeah, you can kind of fine tune things a little bit, but at least again, your foundation is established, and that skincare really is super important with that.
So we talked a little bit about how, you're kind of the point of contact. You're not kind of, you are the point of contact for all of our surgical patients, both before, during, and after the surgical process. Can you emphasize a little bit more on what that means in each step of the way?
When you come in, well, even before you come in, you can call the office and I can help you answer a lot of questions that you're going to find out during your consultation. I mean, I think the most common thing is, how much is it going to cost, right? And so I can go over a lot of that with you and the plan and really kind of just assess you in the way that the doctors will. Again, being here almost 16 years, I have a pretty good idea of what they're recommending for our patients. And so, yeah, patients can send over a photo, happy to take a look at it. I'll even show it to the doctors, of course, to get their opinion on it. And then we'll kind of just work through that process, explaining how everything will work before and after, what they need to do in preparation. And then, of course, once they come in for their assessment, that will be their time with the surgeon. And again, Dr. Albert and Dr. Jackman are awesome. And so they'll explain everything and how it works. And then I'll come in after that, go over the actual plan and pricing. And then once you're ready to schedule, you basically reach back out to me and then we go through that. And then scheduling, of course, you just want to make sure that you are, you've had a physical exam, some lab work, especially if you have health concerns. A lot of patients, do have cardiologists that they see, and again, that doesn't mean that you can't have surgery. We just want to make sure that you're healthy beforehand. That's the most important thing, and what is safe to do. And so oftentimes, the doctors will actually speak with your doctor to correlate and make sure that we're on the right plan with certain medications to avoid, and again, making sure that it's a group effort in recovery. And then, of course, after you've had surgery, a lot of patients will actually use my services, which basically is me coming and staying with you overnight. It's either at a hotel or at their home, and just taking care of them. I always refer to that as they're my newborn for the night. So I'm getting up, I'm icing and cleaning and managing their pain, just making sure that they don't have anything to worry about except recovery. And then the next day when they come in, family member or a friend will pick them up often, and then by then they look a lot better, so then it's not so scary for the other person to this isn't so bad. And a lot of it, honestly, the next day they can really do themselves. It's just nice to have that support system at home. And then we'll see them back for their post-operative visits. Again, they can reach out to me. Sometimes they'll reach out and say, there's this little I'm like, I know it's normal. We'll confirm that, but we're happy to see them as often as we need to, because again, we know that it's a big decision to make. It's your face. And so we want to make sure that you're supported in the whole process.
Okay, I'm really excited. Are you excited?
Super excited.
I'm gonna grab some of these. Do you want some?
Just a little, please.
Hey,
thanks.
Here you go. Yay.
All right.
Gosh. Well, here's to surgical results, maintaining them, and everything that you do for our office.
Cheers.
Woo,
Bon
cheers.
appetito.
It's my favorite episode so far.
Love, love.
So yummy. Thanks for joining us, Adena.
Thanks.
I know we say it all the time, but it's really true. You make this office happen, and we're all so grateful for you. And, from every single aspect of this office, you do a little bit of everything, and you have the biggest heart. So thanks for being here.
I love what I do, so thanks for joining us.
Thank you so much for watching Breakfast at Cheng's. We will see you next time, but in the meantime, be sure to like, comment, and subscribe. See you soon.